Reaction is pouring in tonight to the surprising news that thousands of cancer patients from BC will be sent south of the border for radiation treatment. Patients do want treatment as soon as possible, but don't like the idea of being away from home. The CTV's Binder Sudjan reports critics say this is further proof the healthcare system is in crisis.
Going south for cancer treatment. The Peace Health St. Joseph Cancer Centre in Bellingham is one of two places where British Columbians with breast or prostate cancer could soon be getting radiation.
I just think, my God, when are we going to think about the crisis that our healthcare system is in?
Leah Roundtree is newly diagnosed with stage 3 breast cancer, and she's already been to the States for some scans, which show her case is urgent. If eligible, she says she'd go back for radiation.
Absolutely, I would do whatever is the fastest because that gives me the best outcome. And at the same time, I'd be crying as I pack my bags to leave my family and my friends and my home to go down for treatment.
Data shows radiation treatment waits are getting longer. In 2020, 90% of patients in BC got treated within 28 days. The health minister says that's now under 83%, meaning hundreds of people with a cancer diagnosis are waiting longer than a month.
For them, for those they love and who love them back, it's not acceptable, and it is not acceptable for me. We must do more.
I have raised this issue with the government on numerous occasions.
The opposition says the waits have been building. Adrian Dick says staffing shortages, a need to upgrade equipment, and more diagnoses of cancer necessitated a short-term fix. Starting May 29th and for 2 years, up to 50 BC residents per week may get an all-expenses-paid trip for treatment.
We see long waits to get your diagnosis, long waits to get to the oncologist, and now you may have to leave the country for treatment. And I think it's a significant indictment of the deterioration of cancer care.
The Premier disagrees.
From my perspective, from the perspective of our government, anything we can do to ensure they get urgent care and the care that is medically recommended for them in the time frames that's required is essential.
If I survive this, one of the most important reasons may be that I had the scans that were needed in an appropriate amount of time.
And Binder joins us now from Victoria. Binder, a lot of people were surprised by the announcement of this plan. How much will all of this cost?
Yeah, the health ministry says it has about $40 million set aside for each of the next 2 years, and that includes money for any unplanned expenses. Now, it also notes that planning is underway for cancer centers in Nanaimo, Surrey, Burnaby, and Kamloops. But it looks like the earliest any of those could open is 2026. And by then, according to the ministry's own numbers, we will have added more than 1,000 cancer diagnoses each year. Mi-jung?
Binder Sudjan reporting live tonight from Victoria. Thank you, Binder.